Good afternoon, one and all. Today we welcome you all to the 18th webinar of IAPWC Goa. Today's webinar is on mental problem faced by the geriatric population with disability. We have with us Dr. Roshan Kanekar, who will be taking the talk. Today's host is Dr. Rashmi Pawar. So without much delay, I would like to hand it over to her. Dr. Rashmi, kindly start.
Thank you, Dr. Smanika. So, our speaker for the day is Dr. Roshan Kanekar. She was born and brought up in Sakri, Goa. Dr. Roshan completed her MBBS and went on to do her MD in neuropsychiatry from Goa Medical College. She already has 6 years of clinical experience and is currently working as a senior consultant with Samyak Rehabilitation Center, Pune. Dr. Kanekar has completed a certified course in plastic surgery from GMC. She also has been an ex-senior resident at the Institute of Psychiatry and Human Behavior, Goa. She is the member of Baner Balewadi Medicos Association, Pune, which works for a social cause and has over 400 doctors associated with it. Dr. Roshan has presented two research papers on complications in dementia and comorbidity in bipolar disorder at the Zonal Conference. She is currently working on the effects of psychoeducation on relatives of a schizophrenic patient. So, this was a brief introduction about our speaker for the day. Before we begin, I would like to mention to all the attendees to please pay close attention during the webinar because Dr. Roshan will be having a pop quiz at the end of the session. Feel free to put your questions and queries in the chat box below and we will address it at the end of the session. So without much further ado, welcome again Dr. Kanekar and you may please start the session.
Okay, a very good afternoon to one and all, and thanks Rashmi for the wonderful introduction. So today's topic has many videos. There will be quiz at the end. So let's begin the topic. So before that, a word on our rehabilitation center. So basically, I work with a psychiatric rehabilitation center which plays most crucial role in complete recovery of the patient, because complete recovery is not possible at the OPD or general hospital level, because we can't give enough time to the patient and the patient can't be observed throughout the day. So this is our rehab and this is our team working for the psychiatric patient. So coming to today's topic, it's mental problem faced by geriatric population with disability. It's a very important topic because lack of treatment of psychiatric illness in elderly gradually leads to decline in overall physical health and well-being of these patients. So we all know to care for those who once cared for us is one of the highest honor. So basically, the ultimate aim of our treatment, maybe it in any form, should be getting this bright smile on their face. Okay, so now the boundaries of old age cannot be defined adequately in all the countries. Like in some country, the old age population is very healthy at the age of 60, 70 years, like in countries Japan, Iceland, Spain, Italy. But for India, the definition of senior citizen or elderly is that it's any person who is at the age of 60 years or above. So coming to age statistics of elderly population in India. Now what we can see over here is that population more than 60 years is only 10% as compared to the entire statistic. But if we go this out in figure, it goes to 100 million population. And this number is going to reach to 360 million, which is almost 20 to 30% of the general population by 2050. And this is definitely an alarming figure. So, before beginning the topic, let's see what government has in pipeline for the elderly population. So, every year, 1st of October is celebrated as National Day for Older People. So, government has this policy called National Program for Healthcare of Elderly. So, what does this policy says? The policy aims at providing comprehensive, affordable, and quality geriatric care at the primary as well at the tertiary level. So, what are the strategies in this policy? So, first, at the community level, what the government has planned is that there will be trained personnel who will do house to house visit to look after the health of the elderly patient. What will happen at the primary health center level? There will be trained equipment and trained staff who will look after this geriatric patient. At the district health center level, what government has planned is there will be separate 10 beds which will be dedicated only to the elderly patient with additional human resources who will look after this patient. At the tertiary center level, which is Goa Medical College in JMC Bambolim, Goa, what they have planned is there will be separate postgraduate course which will deal with geriatric medicine. Also, government is planning to involve the folk media, the mass media to increase the awareness of how to take care of these elderly patients. So this is a brief of the previous slide. So additional to that, what government is planning, there will be mobile clinics. There will be training of the caretaker of the elderly because this caretaker are very overburdened with looking after the family matters. Then they have to look after this elderly patient also. Also, there will be research institute which will do research on this Alzheimer's patient, dementia patient, so that they will get into recovery in a much faster phase. So basically, the policy aims at developing a strong workforce between geriatrician, geriatric care provider, medical staff, paramedical staff, including the physiotherapists, to impart a good caregiver skill to the family members of the geriatric patient. So let's see what is normal aging process. What happens is, you can see over here, whenever there is a healthy elderly, by the time it approaches its 70, 75 years, the elderly persons start getting some form of illness. Now, what happens is, as the age progresses, due to this illness, it leads to disability. The disability gradually leads to dependence phase, means due to the disability, the person becomes dependent on the family members. It can't function properly. Now, due to this, what happens is that more and more diseases start happening. First, the age progresses plus the dependency phase. So, more and more diseases start happening. And due to this, gradually it leads to terminal stage, and by 85-90 years, worsening of the health condition and death. So, now, according to me, in a young adult, disability is inability to see the ability of the person. But definitely in elderly population, due to the worsening of the physical health, it will have different meaning. Now, we can group elderly with disability into two categories. First, those who has disability but who can manage their daily routine activity with the help of mechanical devices, or those who have disability but require intensive level of care due to worsening of their physical health condition, due to the mental health problem, or due to many other multiple health issues. So this is the graph. Let's see what are the various kind of disabilities seen in elderly. Now you can see over here the graph in blue and purple is highest among elderly. It indicates there is visual problem which is more common in elderly, and movement problem like movement of the hand, movement of the leg, balance problem. This is very high in elderly. Now what happens with psychiatric illness? You can see in orange below, it's very less detected in elderly. So the psychiatric problem is very less detected in elderly. Now, why this happens? What happens is, as the person becomes old, dependent, the family members are busy looking after the livelihood. They have to look after the children's also, elderly also. So any odd behavior in this elderly, like irrelevant talk, not looking after themselves, is considered as just part and parcel of the old age. So they are not brought to the medical attention early, and this leads to this graph of psychiatric illness to be very low. Now let's see what are the common condition affecting elderly. So there are many problems which the elderly population faces, like Alzheimer's disease, diabetes. They might be suffering from heart problem, cholesterol problem, flu, fracture, pneumonia, sleep problem. They might be having stroke. Now before moving to the next slide, I would like to have word on fracture in elderly. Now we all know that fever is a symptom of our body. Now the cause of fever can be anything. Now in today's time it can be corona, it can be malaria, it can be tuberculosis. Same way, always remember fracture is a symptom. Now, the cause can be anything, like the person might be having vision problem due to which the patient is falling, or might be having very low BP, or sugar might be low due to which the patient is getting giddiness and is falling, or it might be effect of medicine, like some medicine causes excessive sleep, so due to which the patient falls and has sustained a fracture. There can be other problem also, like gait imbalance. There is walking difficulty, which occurs in sciatica in old age, especially in Parkinson's disease, due to which the patient might be sustaining fracture. So always remember, whenever there is a fracture, treat the cause, why the patient is falling. Otherwise, what will happen is there will be more and more fractures. So let's see what is the percentage of illness in elderly population. The most commonly seen is hypertension, which is high BP, high cholesterol, and arthritis. These are seen in very large percentage. We can also see there at the down at the bottom part, depression is 14% and dementia is 11%, which is a really high percentage. Now, at the end of this slide, we can come to a conclusion that what health we will have in our old age depends on what lifestyle we are maintaining during our adulthood. So, I like to simplify this process in the brain as simple as possible. Let's see what happens in aging in the brain. Now, you can see brain figure over here. Now, this is a normal human brain, and this is the old age brain. Now, what is happening? What is the difference you can notice between both the brains? You can see over here the size of this brain is smaller than the adult brain. So, this is the first change, that size of the brain decreases. Then you can see over here this triangular space. This is called ventricle, which is the fluid, the brain fluid filled space in the brain. It's very small in size. It's just a triangle. Now, what is happening in old age brain? It has increased, it has become larger in size. Over here also, you can see there was very small space, but in old age brain, the ventricle has increased. So the fluid filled space in old age brain increases in size. So this is the second change which occur in the old age brain. Let's move ahead. Now, can you see over here? This is a blood vessel. Now remember a pipe through which water is flowing. Now if you press that pipe, what happens? The water can't flow from that pipe. Same thing is happening. This is a blood vessel. So it gets blocked. Now the cause can be anything due to cholesterol or any other problem. So whenever it gets blocks, so the blood vessel, the blood from this end to this end can't pass. So due to which there is decreased supply to the brain. There is another cause is that you can see this blood vessel. What happens when there is increased pressure inside the blood vessel? The blood vessel ruptures. So this is the rupture of the blood vessel. So all the blood comes out. So this is called hemorrhagic stroke. So this lead to bleeding inside the brain and further complication of it. Now another change we'll see in the brain. Now always remember the cell in the brain are different from cell in the body. So in the brain, the cells look somewhat like this. They are called neurons. Okay. Now we know we wear sweater during cold. So same way these neurons need some kind of sweater that is called myelin sheath. Now you can see this round figure over the neuron. This is called myelin sheath, which protects the neuron like sweater protects us during winter season. So same way. Now what happens in old age? This sweater, the myelin sheath, get decomposed or it get toned off, it get wound off, due to which the neuron gets damaged. So this is the next change in the brain. The myelin sheath is damaged. It's called demyelination. So this is the another cause and major cause of the all the changes which occur in the old age brain. So what we learned from the previous slide is definitely the myelin which get degenerated, the blood flow is damaged to the brain. Now this part we'll see later. There is a deposition of abnormal protein inside the brain and there is neuronal dysfunction. It means that the electrical activity which occurs in the brain gets damaged. So this leads to synaptic dysfunction. So these are the major cause of all the psychiatric illness occurring in the brain. So before going into the actual illness, let's see what are the risk factor for this mental health disorders in elderly. So can you see this figure? What is happening? This is the ancient time where there was joint family, there were elderly patient, elderly population, their son, daughters, all the grandchildren, everyone was staying together. So there were people to share emotions, feeling, etc. So what is the current trend? There is a nuclear family trend going on. Husband, wife, and children. And this leads to neglects toward the elderly population. So let's see what are the risk factors. First and foremost, alcohol, especially if that person, if the geriatric person was taking alcohol from adulthood, high chances he or she will suffer psychiatric illness in the elderly. Other causes like poverty, due to which they can't reach the healthcare facility, illiteracy, divorce, unmarried, staying in rural area, any illness, a long-term illness like battling for cancer from almost ages, or any sudden loss of loved one, and chronic pain. So basically, the risk factor is included in this slide. Due to corona, the elderly population can't meet each other. The only way of communication was through telephone. And additional risk factor like medication interaction, again any disability or any loss of mobility, patient is staying alone, so due to which can't interact with anyone. Head injury, this is very important. Any head injury during the adulthood or during the childhood might show his actual picture of psychiatric illness in old age time. So, what are the disabilities which we'll be covering? Will include dementia, depression, psychosis, anxiety, mood disorder, delirium, and chronic pain disorder. So, let's see one disorder at a time. So, coming to dementia. Now, let's see some interesting facts of dementia. Now, dementia is more common in female as compared to males. In dementia, the heart and the brain are interrelated to each other. Why do I say that? Because in dementia, the more the heart problem, the more the risk of developing dementia. In dementia, there is always loss of smell which occurs. And one most important thing I like to tell about dementia is that there is no 100% treatment for dementia. Means whatever the medicine we are prescribing can just stop the worsening of dementia, but it can't get back the patient back to the normal level, especially the Alzheimer's dementia. And another fact I want to tell you is that dementia is the silent leading cause of death of the elderly population. So let's see the cause of dementia. The dementia can be of any type. It can be frontotemporal dementia, Lewy body dementia, vascular dementia, but ultimately the symptom remains the same. First, let us see what is Alzheimer's dementia. Now, let me come to this slide. So, we can see over here that this is normal brain and these are the neurons which I had shown in the previous slide. So, they are lying comfortably inside the brain and they are functioning also normally. But what you can see over here, there is some brown deposit which you can see, right? So these are called amyloid plaque. They are the abnormal protein which gets deposited from the blood circulation into the brain. And once this thing happens, it causes Alzheimer's dementia. So coming back to the slide, so Alzheimer's dementia is caused by the deposition of this abnormal protein. And this dementia, it's irreversible, means there is no 100% cure for this dementia. Coming to the other types of dementia. Now, this dementia can be caused by many factors like any illnesses, stroke, thyroid problem, vitamin deficiency, especially vitamin B12 deficiency. It can be reaction to medication, especially cough syrup and brain tumor. But one good thing about this dementia is that it's reversible. The moment you treat the actual cause of the dementia, like example, if the patient has got dementia due to thyroid problem, just treat the thyroid and the dementia will automatically come back to normal. Same way, if there is a tumor inside the brain, remove the tumor, the dementia automatically will reverse. Now, what are the symptoms of dementia? Now, definitely dementia is associated with memory impairment. Now, this memory impairment is usually noticed in the initial phase by the family members as compared to the patient himself. So, what is the memory impairment this patient might be showing? Like they may fail to pay the bills, prepare meals, any appointment schedule they may forget. Also, there might be impairment in reasoning, means they can't gather information from all the sources and come to a valid conclusion. There might be perceptual disturbances. Perceptual disturbance means they can't judge size of the object, and if this worsen, it may lead to hallucination. Also, they can't focus attention on TV or radio. Like if any task is given, they can't complete it because concentration on that task is impaired. Also, abstract thinking is impaired. Now abstract means, suppose you give situation to the patient, like if a house catches a fire, what you will do? What will be the regular answer? I'll just run away from the house. But this abstract thinking is impaired in elderly. So what they will say is, I will try to run into the next room, I'll try to put water on my body, and something like that. Also, decision making capacity is very badly impaired in this patient. Like if they are crossing the road, we all know when there is no vehicle or when the signal tells, that time only we have to cross the road. But they get confused whether to cross the road or should not cross the road. So these were the psychiatric symptoms. Let's see what are the neurological symptoms. Definitely memory impairment is there. Also there will be aphasia, means if somebody else is telling the patient something, they won't be able to understand. There will be apraxia. The handwriting will gradually start becoming slurred. There will be tremors of the hands. The hand will start shaking. And as the stage progress, the full body will start shaking. It will look like shivering picture. So this is basically all the signs of dementia which I have told, that they can't follow the TV conversation, they will forget the words, or what they're saying, they will forget. Now what happens due to this? Due to all these symptoms, the patient get anxious, feel frustrated, angry, irritable, and due to which there is decline in interaction. They start losing interest in doing anything because of their forgetfulness. And gradually what happens is that they become confused in their own environment. Like if they are inside the house, as the stage of dementia progresses, they might even forget where is the bathroom of the house. So now what to expect in the last stage of dementia? Now, due to all these symptoms, the patient loses facial expression. The patient can't understand anything, so can't even give any happy or sad face to the opposite person. Then, due to this dementia, they might have problem with everyday activities like bathing, dressing, eating. They won't be able to speak because they can't understand what the other person is telling. They will become bedbound and gradually unable to walk, and this gradually will lead to death of the person. So here is one audio. Listen to the audio very carefully. The story is written and narrated by the famous radio jockey of our childhood, who was doing a favorite show, Hello Farmaish. And she's currently a social activist looking after the well-being of dementia patient. So let's listen to the audio.
कितें जालां म्हूण कोण जाणा. हालींसरा म्हाका यादूच शिवरना. फाटल्या दिसांनी म्हजी एक इश्टीण म्हाका मेळपाक आयली. 34 वर्सां आमी वांगडा काम केलें. सुखदुख्खाच्यो गजाली केल्यो. पूण तिचें म्हाका नांवूच लक्षांत येना जालें. पडते पडते हांव ताका आगो आगो म्हणून उलो मारता तें पळोवन तें म्हणपाक लागलें, आगो आगो कितें करता? नांवान उलो मार मुगो पापया, पयलीं मारतालो तशें. पूण जेन्ना हांवें ताका सांगलें की म्हाका ताचें नांवूच याद येना, तेन्ना ताका सामकें अजाप जालें. टीव्ही वेल्यो सिरियली हांव घोस्तान पळयतालें, पूण हालीं तेंय नाका जालां. कित्याक काय म्हळ्यार तातूंतलीं पात्रां कितें उलयतात तेंच म्हाका समजना. कानार ओगीच आवाज येवन आपटिल्ले भशेन जाता. कुकराच्यो शिटयो हांव मेजतां मेजतां फुसपतां. 2 जाल्यो काय 3 जाल्यो तेंच लक्षान उरना. देखून केन्ना शीत घट जाता तर केन्ना मोव पेज. मागीर सगळ्यांचेच टोमणे आयकुचे पडटा. हांव दिसाचेंच सपनेता खंय. कांय कांय वेळार समोरचो मनीस कितें उलयता तेंच कळना. ताका जाप दिवपाची गजाल पयसूच. मागीर हांव डे ड्रिमींग करता म्हणून म्हजी फकाणां मारतात. मारूं बाबडी, म्हाका कितें भोगता तें हांवूच जाणा. तशेंच म्हाका वगीच हालींसरा भंय भंयसो दिसता. निराश जाल्ल्या वरें दिसता. हांव खूब सोंशीत अशीं सगळींच जाणां म्हणटालीं. पूण हालींसरा म्हाका रोखडोच राग येता. म्हजें पासयें सामकें काबार जाता. म्हज्यात चल्लो हो बदल हेरांच्या लक्षांत आयला जावंये. कारण ते आतां 4 हात पयसूच रावतात. पयलीं हांव पब्लीक फंक्शनांनी व्हड्या उमेदीन वांटो घेतालें. पूण हालींसरा 4 चौगांत उलोवप म्हळ्यारूच भंयसो दिसता म्हाका. एका वेळार एका बसकेंत पानाच्या पानां बरोवपी हांव आतां 4 उतरां बरोवचीं म्हळ्यार पेनूच फुडें सरना. तुमकां पयलींचीच गजाल सांगता. कितें तरी हाडूंक हांव बाजारांत गेल्लें. पूण परतें घरा येवपाक वाटूच कळना जाली. निमाणे कडेन हांवें एकट्याक विचारलें, आरे अमकें अमकेलें घर खंय? तर तो पळयतूच रावलो. पूण ताणें म्हाका घरा कडेन हाडून सोडलें. तो म्हज्या चल्याचो इश्ट आशिल्लो खंय. ताणें ही गजाल म्हज्या चल्याक सांगली. तर चलो म्हणटा कसो, मम्मी भायर सरतना तुज्या गळ्यांत आतां नांव आनी पत्तो बरयल्लो पोटो घालचो पडटलो. दर वर्सा आमची एनिवर्सरी घरांत व्हडा दबाज्यांत मनयतात. म्हज्यो भयणी मुद्दाम येतात. तर त्या दिसा ती आयिल्ली. हांवें म्हळें अशी एकदम वांगडाशी आयली. म्हाका याद ना हें पळोवन ती सामकी अजापीत जाली. म्हाकाय आतां भंय भंयसो दिसपाक लागला. खंयच्याय दोतोराक मेळ्यार बरें अशें दिसपाक लागलां.
Okay. So, what a dementia patient would say, coming to the end of a dementia slide. So, what a dementia patient will say, as you get older, 3 things happen. First thing, your memory goes, and I can't remember the other two. So, coming to the next illness, which is depression. Now, depression in Japan is called as kokoro no kaze. What does this mean? We all know fever is a symptom of our body. Same way, any cold or flu of our soul is called as depression in Japan. Now, this depression is more common in male as compared to female. Now, why this happens? Because male population is throughout the life they are working outside, and suddenly after retirement, what happens is they have to be indoor. Plus, all those disability add on to it, due to which depression is more common in male as compared to female. Then, among all the illnesses, the highest risk of depression, which is almost 45%, is noticed in stroke patients. And the suicide rate of depression is 189 per 1 lakh population. And this is really an alarming figure. So, what is the mechanism of depression? I try to simplify it. Now, this is the neuron which I had told earlier, and this is another neuron. And there is some chemical which are going from this neuron to another neuron. So basically, what happens is normally in the brain there is a chemical called serotonin which is present in large amount between the neuron. Okay, so this is normal. What is happening in depression? Can you see the chemical? It is very less. So this is the exact cause of depression. The serotonin which is present in the brain decreases to a large extent, and whenever this serotonin decreases, it leads to depression. You can see over here, after giving medicine and treatment, the chemical which was very less in the brain has come back to normal. Okay. So what are the symptoms of depression? Definitely, we all know the symptom of depression. There is negative thoughts. There is negative view of self, of the environment, as well as the future. There is sadness. There is feeling of hopelessness, helplessness. There is feeling of fatigue in the body. The person doesn't like to eat food, due to which there is anorexia. doesn't like to do any hobbies present, doesn't like any social interaction, avoid any social functioning. As the person is not eating food, it will lead to weight loss. And just to compensate for the depression, they try to binge on alcohol. And also, there is difficulty in sleeping, which is noticed in this depression patient. So same thing, there is little interest in doing all this pleasure activity, there is hopelessness, there is overeating, there is feeling of bad about self. So one more thing I want to tell you is that there is always a bi-directional relationship between depression and pain due to disability. What happens is, whenever there is pain due to disability, it will lead to depression. And whenever there is depression, the pain due to disability will worsen. So both are interrelated to each other. Now, I like to tell one story of Jenny. Now, Jenny is a old age female. She has recently lost her husband. She's staying alone. Her daughter stays very far away, so she just occasionally calls. So let's see what is the life of a depressed patient. So after I lost my husband, cooking seems pointless. I didn't had bath for a long time. The house was in a mess. I didn't collect my pension. Listening to radio was just pointless. I tried to be active but can't due to arthritis. I didn't like to go out and speak with neighbors. My daughter called, but I didn't had any interest in speaking with her. Then I had a fall, got hip fracture and was admitted in hospital. My physio told to walk, but I didn't due to pain. People came to help me, but I started feeling guilty as I didn't wanted to bother others. But they were worried as I won't be able to cope up or will need 24-hour care. Then my daughter came to visit me. She had her own health issue and work problem. Everyone was asking about my pain, but nobody asked me about my feelings. I was referred to psychiatrist and diagnosed as depression. I visited psychiatrist. I was started on antidepressant medication. I was also given cognitive behavior therapy, social support, and group therapy. Gradually, I improved. I came back to my home. I started interacting with my neighbor, and I felt like I was me again. So, this was the story of Jenny. One interesting fact is that if sugar gliders, you can see in the image, are deprived of social interaction, they can become so sad that they can die. Now, coming to psychosis, this is the third disorder seen in elderly with disability. Now, the psychosis is a broad term. It can include schizophrenia, schizophreniform disorder, schizoaffective disorder, and many more. But why a disabled elderly gets this psychosis? What happens is, we all know as the age progresses, the size of the brain decreases. Plus, due to the disability, there is decreased social interaction of this patient. Add on to that, there is sensory deprivation. It means there is difficulty in vision, there is difficulty in hearing, Now, due to these three processes, what happens is there is a chemical change in the brain which occurs. Let's see. Can you see this? So this is one neuron, this is another neuron. So we have seen in depression what happened, the chemical called serotonin reduced to a very large extent, but reverse happens in psychosis. Can you see this dopamine? This chemical increases to a very, very large extent. And when this chemical increases to a very large extent, it leads to psychosis. Okay, now this when these elderly patients get psychosis, they are always associated with very aggressive behavior. Now, due to this aggressive behavior, it becomes source of distress to the caregiver, and it includes delusion and hallucination, which we'll see now. So these are the symptoms. Delusions. What happens is that they feel somebody is plotting against them, somebody is planning to kill them. Then they get hallucination, that is they can hear some voices who are planning to kill them. They don't have any expression on their face. They are not willing to speak to anyone. They just sit at one side and will keep on muttering to themselves. Then they will have some odd behavior, like they won't like to take bath regularly, and they can't even take decision properly because whatever you ask them, the answer will be definitely an irrelevant answer. So these are the symptoms of psychosis. I have one video which was presented by owner of a rehab where Dr. Rupali Chaudhary is acting as a psychotic patient, and the male doctor, which is Dhyanraj Chaudhary, is acting as a psychiatrist. So let's see how a psychotic patient behaves.
Hello, sir. She's my elder sister. Okay. And she is behaving very weird since few days. I don't know what's wrong with her. I found her muttering and looking bluntly at walls. I don't know what's happening with her. Please see.
Hello,
Hello.
what is your name?
You go outside first. Please.
Okay, I'll talk to her and wait outside. Tell me.
So this. She's my sister. My sister and my brother both are planning to kill me. They are conspiring against me, and I know they are planning to kill me. That's why I am very much angry about it.
How do you know?
They talk about me continuously. They are planning. I hear those voices continuously. They are talking right now also. They are talking. I'm hearing. Don't you hear?
Why do you think they want to kill you?
Sir, property matters. Okay? We have a big property. They want to kill me and they want that property. That is the reason.
Now also you can hear their voices.
Yeah. They are talking. They are talking. Don't you hear? Can't you hear? Huh? I tell everyone they are talking continuously about me, but nobody is ready to understand.
Yeah. So
So this is exactly how a psychotic patient will behave who has delusion, hallucination, and can become violent also. Now, coming to the fourth illness, that is anxiety. Now, anxiety is like somebody sitting on your head who never stops talking, keeps on reminding you about your worries, about your insecurity, and make you act on those insecurities, affecting your daily routine functioning. Now, there are various type of anxiety. Generalized anxiety disorder, there can be post-traumatic stress anxiety disorder, there can be phobias, there can be obsessive compulsive disorder. But we will see in general of this anxiety. Now, why anxiety happens? What happens? Let's see. Due to any insecurity or worry, there is always a fear. There is डर लगता है मन में. Now, due to this, what happens is that there is limited activity. Like suppose if there is a vision problem, Definitely, the person will avoid going out because he may feel I may bump against someone and I may have a fall. Or suppose one person is having a fracture. Definitely, that person will avoid going anywhere because the person might feel the more the moment I do, there will be delayed healing of my fracture. Now, due to this limited activity, what happens is that there is limited mobility. The person stops moving. So, due to which there is decreased social interaction. Now, due to this decreased social interaction, there will be decreased sharing of feeling. The person doesn't interact in the family matters which are happening. Then he may give up on hobbies or even daily routine activity. Now, due to this, what happens? We all know that empty mind and body is definitely and devil factory. So due to this, there is lot of space in the brain for keeping on thinking about the insecurities and the worries, and due to which again the cycle continues. Again the insecurity and worries, there is more fear, and again the cycle keeps on rotating. So this is the exact cause why anxiety happens. So these are the symptoms of anxiety. Mostly they are physical symptoms, that there is rapid breathing, there is increased muscle tension, the BP might rise, the patient might feel gastritis, nausea, there can be numbness or even chest pain can be felt. So they might feel while swallowing, there might be feeling like lump in the throat, racing of the heart. The hands might become cold. There can be avoidance or escape from that situation. So, what are the behavioral symptoms? Physical symptom we have seen. There can be behavioral symptoms also, like difficulty in maintaining the relationship due to the anxiety. The decision making capacity is affected. Irritability can be there, or tearfulness can be present. Now, one word on medical condition which may worsen anxiety. Always remember, whenever there is anxiety, the elderly population always have some kind of infection like a urinary tract infection, or they might be having very low hemoglobin which may cause anemia, or due to their lack of appetite they might be having vitamin deficiency like B12 deficiency. Whenever these factors are there, it will worsen the anxiety if already present. Also, certain medicine like anticholinergic, which are given for the lung disease, even Ventolin, which is given for the pulmonary obstruction. So, this medicine might worsen the anxiety condition which is already present in the geriatric population. So this is same slide. Anxiety can present in various way, and these are the various symptoms. There can be irritability, there can be high expectation about self which may not get fulfilled, and crying spells and all. So I have one more video, again same, presented by Dr. Rupali Chaudhary and Dr. Dhyanraj Chaudhary. It's on anxiety. Let's see how an anxiety patient presents, or what are the symptoms of anxiety. Hope the voice will be clear for this.
ऐसा लगता है कि मेरी दिल की धड़कन बहुत तेज हो गई है, बहुत रेस्टलेसनेस फील होता है, स्वेटिंग आ जाता है। कहीं मैं अगर जाऊँ, कहीं जैसे कोई अगर कोई सोशल गैदरिंग्स है, वहाँ मैं जाऊँ तो मुझे ऐसा लगता है मैं सबसे बराबर बात कर पाऊंगी या नहीं, अपने आप को प्रेजेंट कर पाऊंगी या नहीं। कॉन्फिडेंस कम लगता है सर, बाहर जाने से भी डर लगता है कई बार। और अचानक थोड़ी देर के लिए इतना अनकंफर्टेबल हो जाता है कि ऐसा लगता है मैं अभी मर जाऊंगी। और थोड़ा सा पेट में ऐसे बहुत डिस्कम्फर्ट होता है, चक्कर आते हैं। और सर एक्चुअली बता ही नहीं पा रही हूँ, बहुत कुछ होता है सर। उस 5 से 10 मिनट के लिए मैं पूरी तरह से रेस्टलेस हो जाती हूँ, ऐसा लगता है इससे तो मौत बेहतर है। उसके बाद मैं एकदम कूल हो जाती हूँ, रिलैक्स हो जाती हूँ, लेकिन वो 5-10 मिनट सर प्लीज़ मुझे कुछ ऐसा बताइए मैं वो कंट्रोल कर सकूँ। बहुत तकलीफ हो रही है सर।
So you can see how anxious she was while even presenting to the doctor. So coming to next disorder, mood disorder. Now always remember mood disorder include two illnesses. First is depression and exactly opposite of depression which is called as mania. We have already seen the depression part. Let's see mania. The cause, the serotonin change remains same for mania also. So what happened in depression? The patient was very sad, didn't feel like interacting with anyone, was just lying down. So what is the exact opposite of that? The patient is very, very, very happy. It just keeps on talking rapidly, like gets irritable, feels like I'm the god, I can rule the entire world. Doesn't want to sleep because feels only 2 hours sleep or even 1 hour sleep is more than enough for me. The driving is very reckless. What a person does is takes multiple tasks at a time, feels as if is the president or a prime minister of the country. So I would like to show you one video of a mania, how a mania patient present.
Hi, so. Hello, doctor.
Hi. How are you?
I'm fine. You're looking wow, very beautiful. Yellow. Everyone is in yellow. You yellow, I am and even she's yellow. This is very beautiful morning. All are looking like yellow roses. Please, you stop. You know, doctor, 500 proposal आया छे મને. 500.
Good, good.
Yeah.
Do you want to marry?
दीदी, हाँ દીકરો, સરસ છે ના? Oh, doctor, please. Oh,
This
doctor.
okay, this okay.
मोदी मोदी जी बोले थे ना अच्छे दिन आएंगे डॉक्टर, अच्छे दिन आएंगे, पेट्रोल का भाव बहुत बढ़े छे. हाँ, फैशन शो करनो है मारे, फैशन शो.
और क्या क्या करना है आपको?
देश को विकास करनो छे. देश को विकास.
कैसे?
हाँ, I will clean the whole world. देश नहीं, मैं तो पूरा पूरा वर्ल्ड साफ करूंगी और देश का. हाँ हाँ, मैं बहुत कुछ कर सकती हूँ डॉक्टर. या, थैंक यू डॉक्टर.
Okay, so this is how a mania patient presents. Coming to last two disorder is delirium. Now, can you see the slide? What is happening? It's rotating, but you can't feel giddy. You can just observe it, right? So same thing happens in delirium. Uh, Basically, delirium is a medical emergency. Means if the patient is not treated on time, it can lead to death within few hours or within few days. And the symptoms of delirium are clear-cut psychiatric. So what happens is it's a combination of all the illness which I told. Like there will be disturbance in memory, the patient will become irritable, can become depressed, sleep pattern is impaired, there can be impairment of consciousness, attention, concentration. So all sort of psychiatric symptom suddenly appears in the patient, and this leads to delirium, and is actually a medical emergency. Patient has to be taken to a doctor immediately or it may lead to pneumonia and then death of the patient. So coming to the last disorder, it's a chronic pain disorder. We all know that whenever there is a pain, there is tension in the muscle. So this lead to decreased blood circulation in the muscle. Whenever there is decreased blood circulation, there is inflammation, and inflammation leads to restriction of movement and more pain. So finally, this is how the pain will gradually affect sleep. It will lead to delayed healing, more pain, and more sleep disturbance. And the cycle keeps on continuing. Now, what will happen if we don't treat all the psychiatric illness? The elderly patient is just left on its own. Definitely, it will lead to dehydration and malnutrition. Patient will stop eating. The dementia patient might forget to take the regular medicine. It will lead to non-compliance with the medication. There can be loss of self-sufficiency, will be completely dependent on the family member, and gradually it will lead to admission of patient in any institution for a long period of time, and gradually will lead to death of the patient. So let's go in the brief of what is the role of physiotherapist or any paramedic, because in management of this geriatric patient, each and every field, the role of general public is also very, very important. So let's see how we can manage this geriatric patients with disability. So always remember one thing, it's not the magnitude of action, but amount of love and care that we put into our action in management of this patient will bring happiness in their life. So first and foremost thing, have basic knowledge of psychiatric illness in elderly. What happens is in this elderly population, whenever there is a disability, there is a roller coaster of emotion, anxiety, stress which occurs. So if you have basic knowledge of psychiatric illness, what will happen is you will have a proper communication skill and you will be in a better position to empathize with the patient. Now, let's take an example. Suppose you have to tell prognosis or chance of recovery to a patient who is disabled, that it's very bad, that you won't be able to walk again, or it will be very difficult for you to walk. You have to tell this prognosis to a disabled patient. Now, based on your whatever the basic psychiatric knowledge you have, you come to a conclusion that this person is also suffering from depression. Now, at this point of time, you will be very careful in telling the prognosis of that disability, means of that ability to walk or any other thing. Very cautiously you will tell to this patient, because you know, if you tell a depressed patient directly that you will never be able to walk or it will be very difficult for you, it will worsen the depression. It may even lead to suicidal attempt and family discord. That's why having the basic knowledge of psychiatry is very, very important. Next, ensure access to primary care for people with mental health problem. Wherever you're working, have basic knowledge of which is the nearest psychiatric healthcare facility available. If symptoms are there, where to refer the patient. Have basic knowledge of emergency helpline number, because what will happen is if you do this early and if the patient receives the treatment early, it will definitely improve the outcome and the prognosis will be really, really better. Also, it will avoid any legal complication and even avoid family discord which may arise due to abnormal behavior of the patient in the family. Next. Now, always eliminate any misconception or any stigma which the patient or the family members have about psychiatric illness. Now, this misconception are too many. It's like only mentally weak people will get it and mentally strong people will never get it. This is the most common stigma, which is not true. Only rich people can get, poor people can't get. Once someone gets mental illness, they are to be abandoned. Why? Because they are of no use to the society. They may become violent. Or there is one more misconception is that if elderly person start behaving abnormally, what a family members feels like they're just faking it because they just want attention. So this misconception has always to be broken. Now, let us see in brief of how a physiotherapy can help in psychiatry. What you can do is in your sessions, with each physiotherapy session, there is you'll notice improvement in body movement and functioning. So what you can do is use this in psychosocial approach. Means the moment you notice any improvement in the patient, appreciate it. Appreciate in front of the patient. Let the family member appreciate the improvement. Give them in percentage. Like in the previous session, there was 40% improvement. Now there is 80% improvement, which is definitely a good improvement. And the moment you do this in the psychosocial approach, approach it in the psychotherapeutic part. It means the whatever improvement you are noticing, let them make use of that improvement in daily routine functioning. So what will happen is that the patient will also feel better, the family members will actually see them incorporating the improvement in the daily routine functioning, and gradually it will improve the psychiatric well-being of the patient. So coming to the next thing, relaxation technique. Now we all know that yoga is the most important for improving in psychiatric illness. It will help in improving the attention, then memory will improve, the irritability will go down, it will help in reducing the anxiety and depression, it will reduce the stress. And if the elderly population can do any form of yoga which is comfortable to them as advised by the physiotherapists or their orthopedician or their doctors. But one thing I would like to tell is that what happens is this elderly population, whenever there is a disability, they find it difficult to do all those yoga positions. So I would like to tell about this Benson relaxation technique, which does not require mobility at any joint or even getting up from the bed for this exercise. So even if you're listening, you can even try it for 1 or 2 minutes as I'm saying. Before starting, Benson relaxation technique require only one thing. You have to remember one word which is neutral. I mean, it should not be any stress provoking or anxiety provoking. Like the word can be body, mind, soul, or it can be any alphabet, or it can be any number like 7, 8. Just remember one word and then we can go ahead with the exercise. So what you have to do? First, be in a comfortable position. Whichever position you are, just sit or sleep in a comfortable position with all your muscle relaxed. Be in a relaxed position. Focus on your tongue. See, when you are stressed, the tongue tries to press against the upper jaw. So get it relaxed. Once you're done with this, what you do is start closing your eyes. So once you close your eyes, start focusing on your breathing. Breathe in and breathe out. And start focusing on your breathing. Breathe in and breathe out. What you have to do is the moment you breathe out, start saying that word which I have told, the neutral word, whichever word you are recollecting. So breathe in, breathe out, say that word in your mind. Again, breathe in, breathe out, and say that word in your mind. Do this for 10 to 15 minutes, and then you can open your eyes. Now, this exercise has to be done in the early morning before waking up from the bed. You have to do it 2 to 3 times a day, but avoid it doing 2 hours after meal, any food, because the meal always interact with the relaxation process. So do this exercise 2 to 3 times a day, preferably not 2 hours after meal, and the geriatric patient will definitely notice improvement. And always remember, if you are breathing in, breathing out, and remembering the word, and suddenly the anxiety provoking thought come or any stress or tension come, just say, this is what Benson has told. Oh well, I will be able to manage it. Let me finish this exercise first. So do this, breathe in, breathe out, say that number any 2 to 3 times a day, and definitely it will help in improvement. So what are the next thing we can do? Always encourage hobbies of the patient, like reading, being active on social media, cooking, gardening, listening to music, watching TV, because this will definitely help in improvement of mental health, reduce stress, and it will improve the overall well-being of the patient. Always encourage pet therapy. If there is pet inside the house, let the elderly population interact with them. Why? because it will definitely improve their verbal communication skill. It will improve their social skill, and it will reduce their boredom and will have a positive outlook. Then, very important, spend time with them. Whenever you're free, just interact with them. Always remember, even one phone call of yours in the morning can make the entire day beautiful. Now, we all know this, like listening 5 to 10 songs a day can improve the memory, strengthen the immune system, and reduce depression risk by 80%. This is one of the study. I think we all can try it. And then make them positively involved in family matters. Like if any decision has to be taken, ask them, tell them to give their opinion. And if their opinion stands correct and if you are able to use it in daily routine, appreciate their positive participation. Now, this is very, very important. Encourage compliance to medication. Now, what happens is, uh, first only tell them that taking medicine of psychiatric illness or any other illness is always challenging. In psychiatry, there will be more than 4 to 5 medicine in a day which the patient has to take. So encourage their taking the medicine. Second, give them brief idea of what is the side effect of the medicine, because it should not create anxiety later. What you have to do is involve the family members. Whenever any sessions you are giving, let the family members come and supervise the medicine, because what happens in dementia, they might forget to take the medicine. That's why involvement of family members in compliance is very, very important. And one more important thing is that always tell the patient, once you feel better, you're not supposed to stop the medicine. The medicine has to be taken for the duration as told by the doctor. And one more is that always appreciate whenever they take the medicine. Give them some good words. It will encourage them more in taking next dose of medicine on time. So this is the last slide and it means the same which I had already told. So ending the slide, we all know that best classroom in the world is in the feet of elderly. And respect your elders and the world will always respect you. So thank you.
Thank you, Dr. Kanekar. Such a wonderful and interesting session. Would you like, I'd like Dr. Parul to take the question answers right now.
Yes, thank you, Dr. Rashmi. Dr. Roshan, I have some few questions from the panelists. Yeah. So first question goes by, how do you distinguish between dementia and delirium?
Okay, what happens in dementia is that dementia is a long-term illness, means it takes almost 3 to 4 months for the memory impairment to begin, and there is no disturbance of consciousness. Mean patient is aware of the surrounding in the initial phase, but what happens in delirium is that it's a sudden onset of symptom. There will be, including the memory impairment, there will be violent, aggressive behavior, and it will come up suddenly within 24 to 48 hours. So this is the basic difference between dementia and delirium. And one more thing is that dementia is usually seen in elderly population, but delirium can happen to anyone, adults, old age, even teenage. So this is the main difference.
Okay. Okay. Thank you, doctor. I have the second question, which goes by, when do we need a psychologist versus a psychiatrist? How do we know it?
Okay, so whenever a person is having symptoms, what you can do is, if you feel a patient is having a depressive symptom or psychotic symptom, come to a psychiatrist. The psychiatrist is one who has completed the MBBS degree, then the post graduation, that is MD, master degree or diploma, and then is qualified as psychiatrist. So what the psychiatrist will do is will give you the medicine if required, and then will refer to a psychologist who usually they can't prescribe medicine. they can give counseling session to the patient for the improvement. So this is the basic difference, is that psychiatrist is the one who is qualified doctor with post graduation degree. A psychologist has his own master course in psychology. The psychiatrist can prescribe medicine, the psychologist can't prescribe medicine. So this is the main difference.
Okay. Thank you. The third question is, what steps can be taken in our lives to avoid any mental illness during old age?
Okay, so basically what we can do is maintain a healthy lifestyle during our adulthood. This is more than enough. But if there is a genetic factor which is present, like if the parents had any illness, then we can't stop from occurring, but maintaining a healthy lifestyle, mental lifestyle as well as the physical, can at least delay the development of psychiatric illness. So what I would suggest is maintain a healthy workload balance, the family life, encourage your hobbies. If any pet is there, continue with the pet therapy and all, and it will definitely help in at least delaying the occurring of psychiatric illness. If genetic background is there, if no, then definitely it will avoid any psychiatric illness.
Okay. Thank you, doctor. The fourth question is, how to help a patient who is having insomnia and is unwilling to be on sedatives?
Okay, for insomnia, it's the first we have to find why the patient is having sleep problem. Is it a medical condition, like is having sugar problem or BP problem due to which the person can't get sleep, or is the psychiatric illness? Now, once we come to a conclusion that it's not a major illness and will require only low dose of any sleeping pill, we usually prescribe. But if the patient doesn't want to take those sleeping medicine, there are some therapies which we give for the patient, like sleep relaxation technique, and there are many more technique which it's a big session. Those therapies are given which will gradually help in improvement of the sleep. Yeah.
Okay. Okay. Thank you. And the last question goes by, how to manage anger issues in a person who gets provoked on smallest of things?
Okay, it depends on the what age the person is having. Like in geriatric population and in teenage, the treatment is medicine is completely different. For anger issue, what we can do is we can start with medicine. If the patient is not willing, then we can go ahead with anger relaxation and all those therapies which we can go ahead with it, and it will definitely control the anger. And one more thing, in child, if there is anger issue who get provoked by small matter, the involvement of family is very much important. I mean, therapy for child is important, but therapy for the parents or whoever stays with the person is definitely important. So all these members has to be involved in getting control over the anger issue which are arising due to small issue. Yeah.
Okay. Okay. Thank you, doctor. We are done with the question answer part. Over to Dr. Rashmi.
Thank you, Dr. Parul. Dr. Roshan, would you like to do the pop quiz at the moment?
Yeah, sure. So what we'll do is there will be 5 questions. You can reply in the Zoom inbox which is there. Whoever will give the correct answer, and the winner, we can give a title of most attentive listener. Will it be okay, Rashmi?
Yes, doctor.
Okay, okay. So let's go to the first question. So, which is the most common physical health condition in elderly? It's a physical health condition which I had shown in a slide, which is the common in elderly patient. Okay, you all can reply. I can give a time of 30 seconds. 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 30 se Okay. Second question. Now, I had shown in Dementia one famous radio jockey on a video audio was there on Dementia. So you have to identify the voice of the famous radio jockey in the Dementia audio. Okay, coming to next question. So, which chemical is responsible for depression? Okay, next question. Name the relaxation technique for elderly disabled patient. Especially who have restricted mobility. Okay, last question. Mental illness is an illness of weak brain. True or false? Okay, this was the last question. Okay, so Rashmi, can we have the winner?
Yes, Dr. Roshan, I think that I'm sure there is a tie.
Okay.
Yes, so many of them have answered quite correctly, except for one question which you need to give the answer for.
Okay.
Was the dementia video.
Okay. So basically, it was for Goa. She was a famous radio jockey. Her name is Pratima Shirodkar. She is currently social activist helping dementia patient. She is retired now, and if you can remember, during our childhood, especially Goan people will remember, we were giving farmaish for songs and all. So they were the radio jockey during that time. So answer was Pratima Shirodkar. I think nobody got it.
Nobody got that. Nobody got that.
Maybe
So,
Goan people will be able to get it.
yes, exactly, Doctor.
Okay, it's okay. We'll answer on 4 questions.
So Dr. Yashasvi Dave, I think she
Okay.
has answered quite correctly,
Okay.
and Dr. Parul Dubey also. Parul Nayal, sorry.
Okay.
So I think these two doctors have answered quite correctly.
Okay. So Yashasvi, Dr. Yashasvi and Dr. Parul are the most attentive listener of this session. So congratulations to both of you. Okay.
Thank you. Thank you
Yeah.
so much.
Thank you.
Thank you, Dr. Roshan. Over to Dr. Palasha for the vote of thanks, please.
Thank you, Dr. Rashmi. Good afternoon, everyone. I feel very gratified to deliver the vote of thanks for today's webinar. I'd like to thank today's speaker, Dr. Kanekar, for the valuable insight on mental health problems faced by disabled elderly population. Thank you for shedding light on this much needed subject. Also, I would like to express my sincere gratitude to the technical team and our IEP Women Cell team of Goa for their relentless efforts and our teamwork. Last but not the least, I would appreciate our attendees for taking out their time and participating. I'm sure you have benefited from today's webinar. I hope you have a great day and a wonderful week ahead. Thank you.
Thank you.
Thank you all for attending. With this, we have come to an end to this webinar. Thank you, Dr. Roshan, for giving your time and this valuable session to us.